if I speak about COSEXA, COSEXA is a College of Surgeons of East, Central, and Southern Africa. And what it is encouraging is actually training of surgeons where they work, including rural hospitals. So that actually removes one barrier to surgical training, which is that you have to go to a big university and train there. So that's actually something I would encourage a lot of young doctors to look at. And this year, I think if you looked at the number of, let's say, orthopedic surgeons who were produced by the main universities in Kenya, University of Nairobi, Moi Teaching, and the ones who have trained through the COSEXA program, the numbers are almost at par.
An estimated 1.1 million Kenyans fall into poverty each year. And that's because of healthcare costs. Would SHA shift UHC change that, or is there more? Or perhaps, what's the difference between a pharmacy with a blue cross and a green cross? What about cancer and the rising incidence amongst the youth? Is it just lifestyle changes, or is there more? Women's health, men's health, your children's health, the economy, this and more awaits you on Season 2 of Kenya's favorite health podcast. My name is Dr. Diana Wangari Gitau, and welcome to Season 2 of the One Health Lens podcast. Hello, welcome to the One Health Lens podcast, where we have conversations around health and related topics, making them simple and easy for you to understand. I'm your host, Dr. Diana Wangari Gitau.
And I am Simon Moshara Kigondu.
Today we're having, again, a very important conversation with a very important guest. We'll be talking about surgical practice in Kenya and a lot more. I'll first let the guest introduce himself and we'll get going.
Thank you so much for this opportunity to talk about surgery and why it's important. My name is Dr. Nicholas Okumu. I am an orthopedic surgeon by training. I work at Kenyatta National Hospital, and currently I head the Department of Orthopedic Oncology. So my passion is around cancer care, and especially bone and joint cancers. And but I also do other things, which
like
we'll
what?
which hopefully we'll talk about soon.
Yes.
So I'm also a serial entrepreneur. I co-own about 3 other businesses, 2 in the medical space and 1 which is about accommodation, short stay. I don't want to mention their names today because I don't think that's what we are here about.
Yes.
But that's one of the things I do. I'm also an advocate for surgical access. And this year I was very proud to be nominated as a Global Surgery Advocacy Fellow by Operation Smile. And I think that is a wonderful recognition of the work we're trying to do around surgical advocacy. Lastly, I'm an author. I do write opinion pieces in the Star newspaper. That's your competition. And those are around surgery and medical issues. But I've also recently published my first work of fiction, a book named Shadows Behind the Screen, which looks at stuff around the online space and the dangers of the internet. So, yeah. I'm also a father and a husband. Thank you.
The last 2 are the most important
Very
ones.
important.
Karibu, Doc.
Thank you.
Maybe we start off with most people usually associate, and I'm glad you gave us that overview, because most people would say doctors are stuck in their path, clinical practice. But you've mentioned advocacy, right? And advocacy, first of all, what is it? But then what led you into that?
Okay. So advocacy, if I would define it in a simple way, is just speaking up about issues that you feel are important, that may affect you or affect others. And what you're trying to do is influence, change people's thinking towards those issues, and hopefully in a positive way. you can actually be a bad advocate. Sometimes people advocate for bad behaviors and safe practices, but hopefully what we're talking about here is for positive change. So advocacy is just speaking up. And the reason why this is important, especially for surgeons, is because a lot of the issues that we deal with in the operating room are affected by people who are not in that operating room. For example, let's talk about resources. To do an orthopedic surgery, you need a surgical implant. You might need some equipment to take images. And those are funded by people above your level. So you have to have a way to speak to these people and to the public at large so that they can actually push for you to be adequately resourced. And hopefully, as we discuss these issues around surgery, you'll see why that's a big problem that we face.
I mean, and we let's even get to the problem, because if I'm listening to this conversation or watching this conversation, and we're thinking about healthcare challenges that people face, a big part of it tends to be access, right? So if I am not able to even get medication in my healthcare center dispensary, before I even start thinking surgery, it's too far removed, right? I'm thinking of basics, right? So then in that case, what would you say, if I'm listening to this, is the first point of, actually, let me reframe this. From a primary healthcare, from that dispensary level, does surgery actually fit in? Because we know those services are not provided in a dispensary or a health center. Does it fit in?
Okay. So there's a popular coin phrase called global health. And if you look at global health, surgery would be referred to maybe as global surgery. But surgery traditionally has been, I can say, the neglected child of global health.
Yes.
So around the world, if you were to look at a phrase we like to say, safe surgical, obstetric and anesthesia care, around the world, 93% of the world's population lacks access to safe surgical services. So that's a big deal.
Yeah.
If you were to look at it in numbers, and not to scare anybody, in Africa that actually translates to 1 billion people. 93% of Africa's population. And the reason why people ignore surgery, or when people are making policy, they think surgery it's a bit complicated. We can't finance it. This is expensive. And that's a reason why we find that people ignore surgery a lot. They try to focus it in big cities, maybe more specialized hospitals. And the problem is that the people who need surgery are not in those big cities. They're not near those specialized hospitals. So we have to find a way to provide surgical services at the most basic level. And that means primary health care has to have a focus on surgery as well.
I mean, so then what's required, and maybe even before we go to what's required, is that the same situation you see, Dr. Kigondu, that surgery is neglected primarily in rural areas or even places that are not the big cities?
Again, we want to thank Dr. Okumu. He's actually doing a good job in advocacy for surgery. But traditionally, surgery is hard. I wouldn't do surgery myself. It's very hard, by the way. Surgery is hard because you need a lot of knowledge. There is the misconception that it's just cutting. But, when you cut, you need to know what you're cutting so that your outcomes are good. Secondly, surgery has very few mentors. And if you do a survey today of internship, and the people who come out of internship wanting to be surgeons, majority of them are out of own initiative, because a lot of the centers across the country, there is some form of the surgery does not inspire a lot of people to actually. Part of it is poor exposure. And poor exposure is one, maybe lack of personnel, or a lot of times you'd have general surgeons, but surgery is wide. There is a general surgeon, there's a cardiothoracic, there are the orthopedic surgeons. Previously in our time, maybe that was good, because the general surgeon did everything, so you'd sort of almost be exposed to everything. That was early on. But with the entry of such specialties, and also with the inability sort of to absorb these people, then the exposure becomes slightly less. Make also the time that has been dedicated to surgery now has actually been reduced, with the entry of programs like psychiatry and community health in internship. And therefore, we are seeing, and maybe Dr. Okumu needs to work on that. How do you get a positive, how do the interns get positively affected by surgery? And people do not do what they are not confident in. So immediately someone finishes internship and they think that they are not confident in surgery, they will not do it. And I'm saying this to compare directly with obstetrics and gynecology. When you enter internship, yes, the first thing you do week 1, week 2 is cesarean sections. And also maybe the surgeons need to work with the gynecologist, because the first entry into surgery is actually obstetrics and gynecology surgical operations. Because at the end of the day, the technique is more or less the same and all. Now it's only at a different part. So maybe a way of enhancing that kind of relationship to have a positive impact of surgery on the intern.
It sounds like it's not neglected as much. It's more guidance that's required.
I would agree a bit with Dr. Kigondu, but there are things we have actually done in the surgical space, especially in Africa, to try and enhance surgical training. For example, if I speak about COSEXA, COSEXA is a College of Surgeons of East, Central, and Southern Africa. And what it is encouraging is actually training of surgeons where they work, including rural hospitals. So that actually removes one barrier to surgical training, which is that you have to go to a big university and train there. So that's actually something I would encourage a lot of young doctors to look at. And this year, I think if you looked at the number of, let's say, orthopedic surgeons who were produced by the main universities in Kenya, University of Nairobi, Moi teaching, and the ones who have trained through the COSEXA program, the numbers are almost at par. Okay. Another thing that maybe people think about surgery in terms of investment, that it's costly. If you were to do a cost kind of, I'm trying to keep it simple, not be an economist, but if you were to compare an investment in a surgical service vis-a-vis something like a non-communicable disease, you'll find that actually the investment in surgery will turn out to be cheaper and actually have a greater impact. So with an investment of as little as $1 a day per person, you can actually provide very comprehensive surgical services around the country. So it's not as expensive as people think. And then, again, just to play with numbers, if you look at the people who die annually because of something that could have been solved with a surgical procedure, on the continent of Africa, that is 16 million people. Why wouldn't I invest in saving 16 million people?
Okay.
It's worth it.
Fair enough. I mean, let's go back to then, okay, training is covered or we are working on it, right? How then do we get to this access to these services to someone who is not in a city, right? Because as you're saying, it's a challenge. There are some serious problems such that when we talk about primary healthcare, we're not talking about just nutrition and, let's say, communicable diseases and routine infectious diseases. Surgery should be part of this. Why should it be part of it?
Because simply, like we've said, Doc, it will just save lives. It will make a big difference. Now, the problem with surgery, and I understand where Dr. Kigondo comes from, is that it's differentiated. So we have surgery for cancer. We have surgery for general things like a cesarean is still a surgery. You might have a patient who has been in an accident. They need surgery. So we need to find a way to have, the same way we have said we have a benefits package. Can we determine what are the basics? What are the types of surgeries that must be available everywhere? Make those available, and then streamline the system so that those who require more specialized work can come to those centers faster. And when I talk about that, I really want to focus on cancer specifically, because again, we are seeing many patients go through a referral system that is very convoluted, so that by the time they are arriving to my office in KNH with a bone tumor, unfortunately, most of the time it's too late. The tumor is really big. It has spread to the chest, and there's not much we can do. So I know surgery is complex and diverse, but maybe we can try and see what are the basics we can give in any place in the country, and how do we streamline the system to send the specialized ones to the right facility directly.
Okay. Are you getting support in this, right? Because as currently, what policies exist, right? Because you're saying referral system, what policies exist to support?
Okay. So globally, what the world agreed a few years ago was that every country needs to have something called a national surgical plan. Unfortunately, Kenya is one of the countries which has a plan written somewhere, but has never been implemented.
We're a country of good policies.
In fact, only 5 countries in Africa have actually adopted officially a surgical plan. The one that I will always be proud of and want to speak about a lot is Rwanda, and their plan came from Kenya. It was developed by Kenyans. And that's the sad part, that there are brilliant minds here who can put together a plan, and another country can adopt it, but we are not doing it here. So if we had a national surgical plan, it would outline these things we are saying. What is essential needs to be at this level. What is more specialized needs to be at this level. What kind of resources do we need to provide so that these services work efficiently?
Why do you think we're failing at implementation, in your opinion?
My thinking is it's around 2 things. Like we've said, people might think it's complex, it's too complicated. Maybe we should focus on malaria, and simpler things. I don't know which other disease is simpler. And then the other part is, so people think it's complicated. Maybe we think it's expensive, but I've just outlined that it might be cheaper and more cost effective to invest in surgery. And then the other thing is maybe my fear is that, like we've said, we have not been speaking enough as surgeons. Are we advocating enough for the things we need to make surgical care available?
Kigondo, what's the role of professional associations in such matters where there is policy or maybe there is call for a plan? Where do professional associations sit in this?
So advocacy, as Dr. Okumu has put it, is key. The fundamentals of healthcare, the pillars are known. You need governance, human resources for health, and the healthcare financing. So where healthcare financing is directed, it tends to improve that particular service. I'll give you an example. As NHIF developed, the Kenya Medical Association was privileged to be one of the board members of NHIF. And as the people, our representatives were the people who are representing actually 2 constituencies, the healthcare professionals and the patient, because it is the healthcare professionals who see the patients. So one of the things we did, and Dr. Okumu will attest to this, is to push, for instance, for surgical packages. So if you can't pay for a surgery, then this will not develop. And one of the greatest developments of the surgical field was as a result of surgical package, which made access to surgery a reality for people who previously were unable. So it would probably be very nice to do a study of before and after access of the surgical packages, because people had stayed at home with all sorts of surgical conditions due to inability to access. So a big part of the professional associations is that representation.
In the next few years, we might see a very different story when it comes to surgical care, and more especially when it comes to around cancer and the surgeries that patients need. But I hope, I think there can be a change.
And finally, where do we get your book from?
My book, my website,
Amazon.
drnicholasuokumu.com.
Yes.
And there you can also get information around the fellowship and the other things I do. So I'll repeat it, drnicholasuokumu.com. The book is also available on Amazon. If you like a digital copy, that's available for you. And lastly, we are working to get it in some of the major bookshops around Kenya, and that should be coming soon.
Dr. Kigundu, I hope you've bought a copy.
I'd like to say Dr. Diana bought a copy.
Absolutely.
And she has actually read it and given me feedback.
Yes.
I'm grateful that she liked it. It would be very awkward if she didn't.
Absolutely.
And thank you for that.
Thank you so much, Doc, for coming. We'll keep talking. I like, again, that you're thinking outside the box. It's not just clinical practice. You're thinking about the patients in terms of advocacy, in terms of how do we finance it. Thank you so much.
Thank you also.
And thank you for joining the One Health Lens podcast. We'll see you next time.